Welcome, everyone, to Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Tonight's show is country comparisons. I'm going to talk about the comparisons between really not just different countries and how they're dealing with this pandemic, how they're dealing with the virus, what types of safety measures they're taking, what kinds of assistance are they providing to people, and how a particular city in China that has gone several days now with no new cases of COVID-19 got to where they are right now. How did they flatten the curve? How did they stop the spread? I think you will be surprised at all of the things that they do. And how do we compare to that? Are we up to snuff? Because, folks, our president has just announced that he is considering, after the 15-day period that commenced in the middle of March, that he will reopen the government, send people back to work on Easter. And I'm going to tell you why I don't believe our country will be in any position to do that. We're going to look at the differences in different countries that have already had the pandemic ravage their countries and how we compare. And we also have a very special interview tonight with a former intern of ours named Ruben Flores, who recently made it back into the United States from Panama by the skin of his teeth. He barely got back into the States. And we'll find out from his perspective of somebody that's been living in another place and then had to hightail it back to the U.S. and went through 5 different airports, what his perspective is on how the COVID virus is being handled in both countries. All of that is going to be on today's show called Comparisons. We're doing these comparisons, and some of them are valid, and some of them I don't know if we should be making the comparisons. But first of all, I want to thank all of you who have been sending me information, who have been talking with me about ideas of how we can help our community. I want to remind folks that during these difficult times, if you are a local business, if you are a local organization, nonprofit, and you need to get an important community message out to everyone, do not hesitate to contact our station. There's a variety of ways of doing that, so that we can get those important messages out for you. We'll be doing this free of charge. And so I want folks to be able to follow us, find us, and be able to message us. And, of course, make sure that you go to kpppfm.com/donate so that you can support this local programming.
Exactly. It's a good website, too. It has a lot of content on kpppfm.com. That's where we put all of our shows and our history and our other programming. You can find the Mexican Crossing Lines, Finding Me, Cafe Rica, and also our history. And as Cindy mentioned, please support us by going to kpppfm.com/donate. Make a tax-deductible donation. Help support our station and our work so we can do programming like this. You can also call us at 701-566-0917. Again, that number is 701-566-0917. It's a call-in line. You can leave a message up to 3 minutes, and it's a great way to get information out. If that's not something you want to do, you can email us, Cindy at kpppfm.com, Duke at kpppfm.com. Also on Facebook, 88.1 FM, People's Press Project and Mexi-Can. Tweet us at media_PPP. And, YouTube. Duke 1517 is the channel that we put our shows up. We premiere these shows every night after we do them on Facebook Live. So if you missed it here, you can catch it there.
Now, I want to read a couple of messages from our audience. One of them in Spanish coming from Omega Saludos a todos y a todas y que se desvanezca el virus. Meaning, salutations to everyone, and may we vanquish the virus. I hope that we do. And, there's another message here from somebody that's living in Alabama. Mary says, Alabama isn't doing anything in their state to stop the spread of the virus. That's pretty scary. Derek says the governor of Wisconsin ordered us to stay home until April 24. So we know that the number of states that have some kind of restriction in place is now, as far as I knew last night, it could have changed by now.
Things changed quickly, yeah.
Was over 30. So we went from like 13 to 18 to over 30 states. And those numbers are going to keep climbing. Eventually, everyone is going to have to do something about this to address it. And worldwide, right now, the numbers just keep on climbing. This is for March 24. We have total confirmed cases in the world, 374,921. Duke, terrifyingly, we have now surpassed in the matter of 1 week, Duke.
Yeah.
We are number 3 on the leaderboard of confirmed cases in the world.
My goodness.
Right behind China at 81,000 and Italy at 63,000. The U.S., as of the time of that picture of a screenshot, was at 42,000. We'll check in here in a minute and see where we're at now as of the airing of this show. We're now above Spain in numbers. We surpassed Spain in numbers. They're sitting at around 33,000. And Germany, that's sitting at right around 30,000. And Iran, that's sitting at 23,000. And France, that's sitting at 20,000. We just jumped right over them.
Yep.
And that's very, very concerning because a week ago we were behind all of those countries that I mentioned. So it seems to me, and of course I told you that this would happen when we had more tests, that those numbers are just continuing to skyrocket.
Yeah.
Let's look at our U.S. numbers. Right now, we are at 53,595 cases nationally.
Wow.
So from the time that picture was taken of the world map and our place on that list, we've gone up over 10,000 new cases.
Wow.
That's really, really fast. And let's look at the number of deaths. We are at 696 deaths and 375 recovered people. So the top states right now that are really suffering from this virus, New York, of course. New York is at 25,000. New Jersey is at 3,000. California is at 2,000. And Washington is also at 2,000. Michigan is getting close. And so is Illinois and Florida and Louisiana. They're trailing right behind. So Michigan has announced that they have a stay-at-home order in place. And, there are still some states that have no stay-at-home in order, no closure of businesses in order under the government or under the state governor or the mayor of your town saying we're shutting it down. Okay. But here's what else is happening as a result of this. As some states are shutting it down, entitled people that feel like they shouldn't be told what to do are taking off to neighboring states to hang out.
Oh, really?
So they can still party and trip the light fantastic. Yeah.
Wow.
And of course, in places like on the East Coast or even on the West Coast, doing that kind of thing can be very, very dangerous because you're basically cross-contaminating across states.
Yeah.
So this is one of the reasons why I believe that a nationwide order should be issued, because people that don't want to follow the rules will find a way to bend them. And that's exactly what is happening. We now have to start putting into place, we now have to start thinking not only of having across the board orders for people to stay in place, but also for how we're going to deal with going into places like pharmacies and grocery stores where people still have to congregate in some quantities.
You know, and it's for a short time. I mean, it's if we do it and we put our effort into it, we isolate, it's going to stop the spread. It won't be forever. We won't be living like this forever, but the more people go out and don't obey these orders and just ignore all this stuff, the longer we're going to have to stay in isolation. And, you know, there's a lot of things to figure out. I was just thinking, like, how do we get new medication without seeing the doctor? And, you know, the pharmacy here does deliver, you know, pharmaceuticals, but what about we need some more aspirin or we need some other things? I don't want to have to go to a pharmacy or a grocery store to get items like that. So I'm looking, maybe I can buy that online. I don't know. But it's like those are the things we have to figure out for our community so we can stay at home.
I just want to make this argument because ever since I heard the president say that he was going to start sending people back to work, probably a lot sooner than anticipated, I started thinking this is probably the biggest mistake he is going to make. There's a lot of people trying to lay blame on the president for the way that he responded to the virus originally and how long he has taken or what kind of information or feelings he had about it. I think all of those things are forgivable given the fact that no world leader has adequately responded or responded quickly enough to this pandemic. It is unlike anything anyone's ever seen. And so people are going to have, you know, a learning curve. And despite the fact that we keep seeing world leader after world leader biff it, do it wrong, discount it in the beginning, you know, they almost like they're going through the stages of grief, denial, bargaining, all of this. And finally they get to the point where they're like, we got to take this seriously. Like even the Italian president crying and telling the country that, you know, we failed, we've lost, you know, we're being ravaged. Only God can help us now. That kind of thing is so stark. Here in America, we still will not kneel and accept that the situation is dire. We still will not break. We still will not learn. And it's very, very worrisome because the first thing I thought was a huge mistake was not seeing Dr. Fauci up there. Yeah. When I didn't see Dr. Fauci, I'm like, oh, this is going to be bad. Because people are already scared. People need clear information. They need direct answers. They need, you know, details. They don't need, you know, they don't need window dressing. They don't need sugarcoating. They don't need, for the president or anybody in the administration or anyone governing in our states to try to shield us from the brunt of reality. We need to know the reality so we can prevent the spread and so we can care for our families. So the fact that somebody that people not only depended upon for scientific and medical knowledge up on that stage from the president's task force, the fact that he was missing, whatever the excuse was, there is no other more pressing or more important place that in either of these people need to be, okay? But the fact that they weren't there, that Fauci was gone, made people start asking questions, made people a little uncomfortable, a little tense. They're like, what's going on? What's happening? And I think that was an error. They should have had the guy there so that he could put some minds at ease. Second thing, there was an effort, is an effort to start kind of planting the seed in all of our minds that there are worse things than the coronavirus and what it will do to our country and the numbers of people that are going to die. And that worst thing is the collapse of our economy, in so many words. And that we have to do something sooner rather than later. And I think that that idea was being floated by the president and several other people online and in government positions, like the governor of Texas. And I think the reactions are going to be forthcoming in the next days and weeks. And my prediction is that our healthcare system is going to be so overwhelmed that the lack of foresight from those in leadership worried about saving our economy, the lack of foresight from those in leadership trying to save our economy is going to result in a lot of people in the healthcare system burning out, getting sick, dying. That includes first responders. Our hospitals closing down, collapsing in many places. It's already starting to happen, folks. Supplies running short, people burning out, all sorts of things. And that people will be forced to quarantine by the time we hit Easter. And I believe very, very strongly that this is going to happen because I am not listening to this particular doctor or that particular doctor. I'm curating information from doctors all over this country and all over the globe. And they all are saying the same thing with regard to how this virus will impact our healthcare system. Every single one of them. So I don't think that people are going to put their lives on the line, or their grandpa or grandma's life, or their nieces or nephews or their grandkids' life on the line when they see how the system is overwhelmed. And remember that this isn't just going to affect people who have COVID. If you have a heart attack, if you have a car crash, if you have some other kind of emergency, there isn't going to be a healthcare system for you to turn to in America in a very short amount of time. Let me show you a tweet that was made. Here's some responsible actions you can take to start to help. We need to start taking these actions all on our own. Irene tweeted, "A very reasonable request from a grocery store manager near me. Send only one person per household to shop. Consider the health of the store employees and the help." And this was a message from the manager. "As a manager at a grocery store, may I please remind everyone that the whole family does not need to come to the store. We are out working to keep you all in a supply of food. Please take our health and safety in mind and help reduce our risk."
Yep, for sure.
Folks, you need to think about this other little piece of information. We have people that are grocery store employees, restaurant employees, truck drivers, all of these people that are essential activities, essential work that needs to continue to operate in America. People that care for the elderly in a nursing home. My daughter does that. She cannot stop working. Here's the thing. Those people are making a pittance. These people are not making what CEOs and business owners, etc. They don't make cash like that. They don't make money like that. And for the amount of money that they're making, many of them, people that go and shop for others during the pandemic, many of them are starting to weigh, do I keep doing this? Mm-hmm. I was reading you, I'll have it on one of my upcoming shows, one of these shoppers that goes and picks up things for people, he said, I went to this store to shop, and these commodities are starting to go away, so that means I have to go to more stores to finish the shopping list for one person. And it's getting harder and harder to do this, and I'm having to go to more and more stores. And within those stores, people are not observing a 6-foot distance like they're supposed to all the time. Mm-hmm. He notices most people aren't wearing any kind of protective gear. Like, the level of connection between how one person is responding to the virus versus another is completely different. And people like him, who aren't just shopping for their own food, they're shopping for other people as a job, have to start to consider whether or not they want to continue to risk their life for $10 an hour, or whatever it is.
Exactly.
So we aren't just headed down the road of a situation where we're going to overwhelm our healthcare system. All of these essential workers who aren't getting paid butt kiss for doing this very dangerous work at the time of a pandemic, they're going to start to fall off and say, you know what? My life ain't worth $10 an hour.
That's
I'm
right.
going to stay home.
Then we're going to lose the people that are doing that work, and then it's another gap in services for people, So yeah, and you're totally right with their wages didn't go up with this pandemic. They didn't all get raises. We're going to give you all double your salaries, double your hourly rate. They're still working for the same amount they worked, 2-3 weeks ago before this stuff really started happening.
I have some comments about all of this from our audience I want to read. Karen says, I heard tonight that New York is offering nurses $100 an hour to go work at their hospitals there right now.
Oh.
Another comment by Mary. I have a nurse that comes to my house. He told me today, unless you arrive in an ambulance, you are triaged outside the hospital. So, folks, yes, this is going to happen eventually. Let's look at what is being proposed at our local grocery stores.
Well, this one's actually in Seattle.
Okay.
Since people weren't obeying the rules and keeping distance, they taped out 6-foot sections, like these little rectangles for people to stand in, and they line up to comply with the social distancing. So they just take them in order, and you stand in your square or your rectangle and the next rectangle. So it's a way for them to be able to keep people to stay away from each other, because people just aren't paying attention.
Yeah, and it's not that we don't have a directive from our mayors, from our governors, from our president that is uniform and across the board for everyone, that's easy to understand. Some places are in quarantine and can't leave their houses after a certain time. Some states are ordered to not have more than 2 people congregate. Some states are still at numbers in the 50s, 60s, or whatever, while the president said no more than 10. Like, we've got too many differing positions on how we're going to handle this. Meanwhile, the numbers just keep going up. And in order to really flatten this curve, we all have to have the same set of facts and the same set of information and instruction. Here's some good news. Fargo has now approved to-go delivery and curbside liquor sales for a 30-day period. There was some restriction on buying food and liquor at the same time.
Yeah, they weren't zoned to be able to, have liquor, and I don't think they can deliver it yet. You go pick it. It says curbside, and they're doing a new policy for 30 days. So once again, I've talked about this, that our government has so many rules and policies in effect. It's really hard for them now to undo those quickly. So the city commission met and had a discussion about let's get alcohol to people in a way where they don't have to go into a restaurant. It can be delivered to their car or a store. And so they lifted the restrictions on that. That's
pretty smart. I think it's, probably a good thing. Sherry writes, Texas is asking retired nurses to nurse or nurses with expired licenses to come work. It's been a long time since I had an active license, but would do it in a heartbeat if I could. I hate autoimmune diseases. Kat also writes into our station saying, my husband has cancer and people are saying he doesn't have the right to try and survive versus others' freedoms. And he's a veteran. Kat, that's terrible. Every life is precious and we should be concerned to do everything that we can to preserve every single life that we can. Let's hear from the World Health Organization chief on the rising number of cases worldwide. Very, very concerning this is. This is from Geneva, Switzerland, March 23rd. A total of more than 300,000 cases. This is very fast spreading.
300,000 cases of COVID-19 have now been reported to WHO from almost every country in the world. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases, and just 4 days for the third 100,000 cases. But we're not prisoners to statistics. We're not helpless bystanders. We can change the trajectory of this pandemic against COVID-19.
According to the WHO, a total of 3,340, 900 some cases have been reported in 189 countries and regions.
This week, I will be addressing heads of state and government from the G20 countries. Among other issues, I will be asking them to work together to increase production, avoid export bans, and ensure equity of distribution on the basis of need. We need unity in the G20 countries who have more than 80% of the global GDP.
So, how are different places in the world dealing with this? Let's take a look. I want to welcome to my program a former intern that we had working here. His name is Ruben Flores. He's recently traveled to Panama, and I want to interview him about his unique perspective on his recent trip. Welcome to the show. Here he is. Hi, Ruben. It's great to have you on the show. Thank you for being with us today.
Nice talking with you, Cindy.
I haven't seen you for a long time. You used to intern for us here at the radio station.
Yeah, it's been a while. A little bit of traveling since then. A little bit of Baltimore, Panama, and now I'm back. Now I'm back here in the Valley.
And you are currently in quarantine, self-quarantine.
Yes, I am. I am self-quarantined. So it's me and my wonderful room. And I'm going stir crazy.
Okay. So tell my audience a little bit about what you were doing in Panama, and how did you find out that the virus thing was going to be a problem for you?
Okay, that's a great question. So I ended up in Panama after coming back from Baltimore, and I decided that I just wanted some international experience. And so I decided on a country that I could go to better my Spanish, and a country that, moving further, I could connect with research that I've done in the past, but give me just a different perspective on things. And so that's why I chose Panama. Also, it's a city. Panama City is it just is the largest city in Central America. And so for all those reasons, I went. And then I learned that there was going to be an issue with COVID-19 really late is when I started to take it in earnest. I would say about almost a week ago now. It is Tuesday. Yeah, almost a week ago now. I started to look into flights because I'd heard that on the 22nd they were going to stop all flights from Panama to other countries.
Well, a
And
lot of Central American countries and Latin American countries like Ecuador and Guatemala, they've just completely shut down their borders to any people from the outside, and
yes,
Americans have been getting left stranded. There's over 13,000 Americans around the globe that are stranded somewhere that can't come home during this virus pandemic outbreak. So, what did it look like in Panama? What was the response of the government? Like, were they shutting down businesses? Were they restricting travel?
yeah. So I guess I can explain it a little bit better through narrative. Basically, they Panama got very serious very quickly. Um, and that made life difficult for me, but that makes life safer for the Panamanian citizens there. Getting serious very quickly meant that as of the 22nd, they stopped all flights to and from Panama, which is why I got out on the 21st, very late on the 21st. They also had recently, I want to say as of the 23rd, closed their land borders, right? So their borders between Costa Rica and between Colombia are now closed, and there's no travel between those borders either. Prior to me getting my flight, they had stopped all cruise lines, people from cruise lines coming into the country. So you were not allowed to get off and go into the country.
Hmm.
It was very serious very quickly. In addition, Panamanian citizens, as of right now, are not allowed to leave their houses except between the hours of 7 to 10 a.m., specifically to gather resources from stores there, and only delineated based upon the hours, um, which we can see on their licenses, whether it ends in a 7, an 8, or 9, respectively, dictates which hour they go to. So the government in Panama is being very serious about it. They have going right now a campaign, a media campaign, which is hashtag Quédate en casa. And so for your listeners that don't speak Spanish, it just means stay in your house, right?
Hmm.
Essentially, like
Yeah,
stay in your house.
yeah.
Um, they're not as authoritarian as China has been, where we have videos coming out of China in which people were literally welded into their buildings. We're
Yeah.
not seeing that level of authoritarian action. However, we have seen media releases that have said that if people were not following the rules of this 7 to 10 a.m. limit on movement, that they would force people to stay in their houses. Um, and so
Would
that
they
has
would
been,
were there any fines or jail time or things like that discussed?
I can't speak to that. I don't know about that. And honestly, I didn't want to find out. Um,
Yeah.
yeah, I remember the day, I remember that it seemed like citizens were not taking it as seriously as the government was, but in talking with my friend who's overseas right now, I mean, they've been forced to take it more seriously.
Were they having a lot of cases of COVID?
Yeah, it depends on what you mean by a lot, right? So by the time that I left, there were a little bit under 100 cases of COVID confirmed. There was one death that was confirmed. Most of those cases of COVID were centralized to Panama City, the largest city,
Right.
where I was at. But they had some cases in the interior of the country, in Colon, which is about an hour north on the Caribbean coast, and one in Chiriqui, which is very close to the border with Costa Rica.
Now, did
So,
you what kind of medical system do they have? Is it adequate? Do you to respond? How does the government feel?
so I think like the way to talk about whether it's adequate or not is through the lens of either a Panamanian citizen versus like a foreigner like myself.
Hmm.
So, and I was actually really funny. I talked with some Panamanian with some dual citizens in uh, in Fort Lauderdale. And as they were explaining the medical care system to me, everyone pays into the system. It's like Medicare for all in the sense that like everyone pays into it, and then once you go, you don't actually pay for the funds. or you don't actually pay any fees for the actual treatment, but you do pay a lot into it. That means that people there can go see a doctor without really having to worry about needing to pay for it, but everyone is paying into it through their taxes. As they reported it to me, those citizens said that the healthcare system feels adequate to handle people in general outside of COVID, that there tends to be stress on the system when it comes to people who are chronically ill. And so they just take up a lot of resources. Um, but otherwise, that the system feels very much adequate. Now, I can't speak to the amount of respirators that they might have, right? And the amount of staffing that they might have. With COVID, but I imagine that it would be very much like we're seeing around the globe, where no country is really fully equipped to handle the 15% of so severe cases of people that would have COVID fill their entirety of their medical system.
So
Um,
you've been
yeah,
home now for a few days, right?
yeah, I've been now here for I've been here for 2 days in quarantine, and I've been outside of Panama flying for about 2 days as well. It was about a 40-hour air trip.
Wow. What
So
was it like? Can you walk us through your trip home? What was that all?
yeah, yeah. And so actually, I think this interesting that it took 40 hours because it gave me four different perspectives through four different airports that I
Mm-hmm.
can speak to you about.
Okay.
So I traveled through Tucumán International, just outside of Panama City. I traveled through Fort Lauderdale, which, as you know, Florida, is a hotbed of COVID right now.
Yep.
Yep, I traveled through Austin for a little bit, or not Austin, excuse me, Dallas. Um, and then I traveled through Phoenix. Um, and so I traveled through those four, and Fargo. So I guess I'm in five,
5.
technically. I was in Fargo for about all of 10 minutes. Um, In Tucumán, they were taking it very seriously. It was, I would imagine, for most of the American citizens that are watching this or listening to this, they would be very taken aback. I want to say like 60% of the people had masks, like myself. Whether those masks did anything or not, I'm not here to say, but you could tell that there were a large bulk of people that were taking it seriously because they were wearing those masks.
Mm-hmm.
Furthermore, institutionally, I don't know if it was sponsored by the Panamanian government themselves, by Tucumán as an airport, but there was a team of fumigators that would come and spray a solution on all of the seats in Tucumán International Airport every hour or 30 minutes or so.
Were they
I was
wearing like those hazmat type suits?
exactly, they were wearing those hazmat type suits.
That must have been
Um,
surreal to see this, coming through and spraying the seats every hour. It must have been, or
Oh
well
yeah, it
in.
was very surreal. It reminded, I mean, it messes with the psychology, right? Like I was already taking the practical steps of washing my hands very frequently. I was already doing that, but what I was not prepared for was just how much it makes you hyper aware of your surroundings. You're aware of literally everyone around you, every move that they're making, where they're putting their hands, right? Um, and becomes very surreal. And you get hungry in an airport, right? And you're not allowed to bring copious amounts of food
Right.
through. So you say to yourself, well, I guess I have to eat. And you're incredibly cautious about having prepared food. You notice whether the people on the other side of the counter are wearing gloves or not, and it's not always assured that they are. It was very interesting. Though this hazmat team was taking things very seriously, that wasn't necessarily the same, could be said for the businesses that were inside Tucumán. And so there was kind of this schism between the like the government, or who I might assume is the
Mm-hmm.
government,
Mm-hmm.
and like private
The
businesses there.
private businesses.
Yeah, private businesses seem to be trying to go about, life as normal.
Mm-hmm.
And I would say that carried through into the United States as well. So after going from Tucumán, where people were taking it rather seriously, I was in Fort Lauderdale, and I was in Fort Lauderdale for 14 hours, which means I had a lot of time to see how people were dealing with it and private businesses. Immediately getting off the plane, I noticed that most people were not wearing masks. If it was more like 60, 70% in Tucumán, it was maybe more like 40, 30% in Fort Lauderdale. And the farther that I got away from Florida and closer to Fargo on my trip, the less and less the masks were present. So that was interesting to me. Um, Businesses were going about life as normal. I didn't see many signs about COVID from private businesses. There were signs, of course, in the airport. I didn't see any people like sanitizing in an institutional level. I saw people take out Clorox wipes every once in a while. But like there was no hazmat suit team in any of the airports that were American. And so that was disconcerting to me in a different sort of way.
Right.
Um, yeah, I would say, and the closer I got to Fargo, the less and less concern I think I saw. Dallas had significantly less people. And then on my flight to Fargo, I was the only person to choose to wear a mask. And I know that people have said varying things out the effectiveness,
Hmm.
right, of masks, and I completely understand that. But it's hard for me to believe that everyone on that flight would have been so well read as to say, I don't think we need a mask. Instead, what I feel was a sort of unconcernedness
Hmm.
coming from people.
Hmm.
That made me just very nervous. If I'm remembering correctly, it was a couple of hours ago that it was released that Grand Forks, where I live, has our first case of COVID.
Hmm.
Uh, so I wonder how seriously we are taking it here in the Valley ourselves. If my flight from Phoenix to Fargo was any indication of it.
Now, did you expect that when you arrived in the United States, there would be people at customs making sure that you weren't a carrier, or maybe taking your temperature?
For asking me that, I was expecting that. That is not what happened. I was very much expecting similar stories to what I've heard about with people traveling back from Europe, where lines were incredibly long and backed up, and people were in close quarters, exactly the sort of thing that the CDC is telling us to avoid. Um, but that was not my experience. I can't say that that was true for me. Instead, when I got into Fort Lauderdale and I got through customs, I was made to do an automatic system over um, over a screen, essentially, where I scanned my passport. They gave me a little piece of paper. Someone at customs scanned that paper, and I was allowed to go through.
So you
Very,
never had
very.
physical contact with any airport staff upon arrival?
If I had contact with any airport staff upon arrival, the only contact that I would have had coming into the States, no one patted me down. It was nothing like that. The only physical contact I had with anyone inside of the airport was at security through check baggage, the multiple times that I had to check my own baggage. And that felt like nothing out of the normal.
Wow.
Uh, So I didn't see from any of these airports as of yet any special precautions, which is weird because while I was in Panama, even before I decided to leave the country, I walked into a bakery and I was very taken aback that as soon as I walked in, someone scanned my forehead to see where my temperature was at.
So now that you're back home, um, I have one last question for you. What what's going on back in Panama? What's changed since you got back? Have things accelerated? Has the government taken any new restrictions? And finally, uh, having this dual country experience, what takeaways do you have for the local people, and what warnings would you tell them that you're struggling with yourself?
Yeah, so I think things have changed in Panama only so far as cases have continued to develop, right? So we're seeing more cases of COVID, and it is spreading to places outside of the metropolitan area. There are more cases in the interior, in places like Colón, like Chiriquí, like the Darien, which is the rural center closer to the Colombian border. So we're seeing more cases that are coming from there. And from talking to my friends overseas, it's just intensifying. So there's more there is more at stake in staying home, and the rhetoric that is coming from people is becoming are they are taking it more seriously. I have a friend. His name is Eudo. He is a um, a transplant from Venezuela that lives in Panama because, like Maduro's regime has done to so many Venezuelans, he has fled the country and is now living in Panama. I have not heard from him about how the country plans on allowing foreigners outside of their house, what their plan is for that. I would be excited to learn how they are going to be thinking about the bulk of populace of foreigners that are there. And I've heard that very recently, for those who would have been like me and may have decided to stay to ride out this 30-day um, flight ban that Panama had put into place, the U.S. embassies are starting to put together plans for helping Americans abroad. So those are things that I'm starting to hear come out of there. And then if I was going to tell people here in the valley about my concerns and what I'm worried about and what advice I would give to them, it would be I am not worried about my own individual health very much. I'm not in a high risk group. I have not manifested symptoms. My temperature was 97.6 when I took it earlier today. What I am worried about is myself and people like me who feel fine, who are in fact carriers, who are asymptomatic carriers, who do not have a cough, who do not have a fever, who have nothing that the CDC says that we should be looking for when it says the symptoms, and just coming into contact with vulnerable people who could get very sick and lose their life. Furthermore, I am incredibly worried about our healthcare system not having the appropriate resources like ventilators, um, and hands on deck to be able to take care of everyone who may get sick. My quarantine is not for me, not really. My quarantine is for other people. And I understand that I have the privilege to be able to quarantine, like so many people do not have the ability to. But we can all take small personal steps to keep ourselves healthy and our community healthy. And if that means for the Ubers that are out there, taxi drivers, or people that are working face to face with the public every day, if that means that it's wearing a mask and sanitizing your hands every 30 minutes and wiping down your keyboards, great, that's what it should look like. If you have the luxury to stay home and do your work from home. That is what we need right now to stay well and healthy, not only as individuals, but as an entire country. And the last warning that I might give to your audience, um, I want to say it was about 2 weeks ago now. Italy was forced, an institution in Italy was forced to decide what people were going to be getting adequate health care. And the reason they had to decide is because they did not have the resources to treat everyone. They chose to decide that people that were younger and had less comorbidities would receive adequate access to health care. And those that were older and had more complications would not be able to receive access to health care. Things fundamentally changed from physicians and those who work with physicians thinking about individuals and our individual health to the health of society overall and splitting scarce resources amongst those people. We still have the ability to avoid something like that. Obviously, our government is not doing the work necessary to keep us well, at least through my subjective experiences going through this airport.
Right.
But we all have the opportunity to take it into ourselves to do the work that we know that we can do to keep us all healthy and avoid another Italy.
Yeah. Thank you so much for quarantining. Thank you for staying at home. Hashtag stay at home. And Ruben, thank you so much for giving us your perspective on COVID-19.
Thank you so much for having me, Cindy, and thanks for the work that you do.
Well, you're very welcome. And You're very welcome. And I also wanted to mention that off the air, Ruben mentioned to me that he did not choose to come back to the United States because he thought that the United States would be a safer place for him to ride out the quarantine, or that we had better healthcare system, or that we would be responding, or that we are responding better than Panama. But that rather his concern was for his family members, for his support system, and who would take care of them if they were to fall ill. So there is a comparison that people are making a lot to China, right? People are saying, well, China, they've already kind of flattened the curve. In some places, they're not having any new cases. And so we can get to that. We'll be able to get to that place. And based on the numbers of people that have gotten sick and died and those that are recovering in China, we also are trying to extrapolate and figure out how this is going to go in our country. And I have some warnings about that I want folks to think about, because we really can't compare ourselves to China or Italy or Spain or France for that matter, or South Korea, because our population isn't the same. For example, in China, half of their population are not morbidly obese or have diabetes. And we have people in our country that have many underlying conditions. Most people have more than one underlying conditions, and this applies easily to more than half of our country that has an underlying conditions or chronic medical conditions. That is just simply not the case in these other countries. So therefore, we can't expect the virus to act the same way that it does on the Chinese population, on the Italian population, on the Spanish population, on the French population, as it will on the U.S. population. And I also wanted to share with you some outtakes, some screen captures from a filmmaker named Takeuchi Ryo. And he is living in a town. He's a documentary filmmaker living in a town in China, a town that has managed to flatten the curve, that has had no new cases of COVID for several days, and what they are doing. Because if we really look at what they're doing, I see a lot of folks commenting during Ruben's interview that they haven't seen anybody spraying with hazmat suits in our airports. They haven't seen a majority of people where they live wearing masks. Let's take a look at what's going on in China, in this town that managed to flatten the curve, and see how America's response compares to theirs. First of all, they're using drones. I talked about that yesterday in my report, that California is now going to be deploying drones to enforce. And they did. And this one has a speaker on it telling people to register. Everyone has to register. And the other thing that they are instituting is in all businesses, because businesses are open, like restaurants, you have to maintain a social distance. In this one, you see, you can't even sit at the same table.
Wow.
You have to sit at a different table with a table in between you and a barrier that is standing up in between the two tables, so that you can't really see the other persons, right? You can't sit across from each other. In addition to that, the taxis there have, this is just like a regular Uber type taxi situation. There's a plastic film there.
Oh, to separate the driver and the passenger.
There's a protective film. If you go to the next slide, you'll see it a little bit closer from the inside of the car.
Okay.
And this protects the driver from the passenger and the passenger from the driver, in addition to which the driver is wearing a mask, and he disinfects his vehicle every three times a day. He's disinfecting the entire vehicle 3 times a day. and there's a protective barrier. I think this is a great idea
Oh,
for
yeah.
local Uber and taxi drivers and people in countries like Mexico, where we saw Anthony interviewing people in Juarez, and they were unable to get anybody to ride in their cab. Maybe if they had some protective measures in place, people would feel a little bit more comfortable.
Yeah.
Now, they also are taking the temperature of everyone in the public when they go into any public space, including public transportation. You see a bus driver here taking this man's temp, and there's some kind of a barrier with a little window so that you just like reach your arm out, show your wrist, and then they use those scanners from far away, so they never actually physically touch anybody. This is also happening inside of the supermarkets. They have no-touch thermometers there. I haven't seen any no-touch thermometers here,
No.
but everybody has face masks. You're not allowed to even go outside without them, by the way. Here is what it looks like in the office district. This is just driving around. There are checkpoints throughout the city, and that you get to a checkpoint, you have to stop your vehicle. Somebody comes and they use these scan thermometers on everyone in the vehicle.
Wow.
If anybody is found to have a fever, they have to be quarantined. They have to be separated. They have to be documented. And there are banners throughout the city that say, "Don't gather, don't gather." Everywhere, all over the city, there are signs and banners. This is apparently very unique to China. Even in the elevators, they have a little box of tissue next to the buttons so that every person that gets in the elevator uses a tissue to push the button.
Oh, good idea.
And then there's a little trash can next to it where you can deposit your used tissues. What are they doing at McDonald's? Well, in McDonald's, they have a schedule that is available for everyone in the public to see. By the way, you know how when you go into the food court, they're all in one space, and there's communal seating, and you can go up to 5 different counters to order. None of that, no more in China. There's one. They blocked all entrances to all the business, so there's one spot you can walk through to order, and one spot where you can pay for your, order your food and pick up your food.
Yep.
This is something that most people don't realize. In this schedule here, you can check it and see what the last time is that they washed their hands, disinfected and cleaned it, and checked their temperatures.
Wow.
The employees that are serving you your food. So it's right there in the open. Also, in China, they don't use money. They have no paper or coin money. I was really surprised to hear this because my brother recently returned from China at the end of last year. He was in China. And he said to me, they don't have money. They don't use money. In fact, if you have money and you try to pay someone with money, they look at you like you're crazy.
What's that?
Where are we in terms of a paperless? We do buy things online. Obviously, we use PayPal, we use Venmo, we use debit cards. We do all of this stuff, credit cards. But in their country, it's non-touch, cashless payments for everything, folks. For everything. So you don't have to hand a cashier money. They don't have to hand you change. You order from far away from the counter what you want, and there's people that are there to give you the untouched food. And it shows you right there that they've documented that this food is untouched. You don't have to worry about it. And they have a delivery map on this little sealed McDonald's package. They put down who the cook was, who the delivery person was, what the temperature. Yeah, every detail. And the people that are behind the service station in these restaurants literally look like they're wearing hazmat suits. So they're very, very well protected head to toe, even though you don't really have to go touch them. Now, the protective gear here, you can see, it's it's pretty solid. They have their head covered, head to toe.
Looks like they're ready for surgery.
Right, ready for surgery, it looks like, yes. And when you come into the restaurant, there's a QR code. When you go into any of these restaurants, there are QR codes everywhere. The use of technology there is really astounding. You walk up to it, you scan it with your phone, and then you have to submit your personal information, which includes whether or not you've been to the city of Wuhan. So you give them your name, your ID number, your address, and they track every purchase, every person that comes in. And there's a sign-up sheet because they take your temperature and they put your temperature down. You have your phone number and your name. So if at any point in time you turn up with the COVID virus, they can literally track every place that you've been and notify all of the people in the places that you've been that there's been a person with COVID there recently. If you go and use the transportation system there, I showed you what the bus was like. If you go into the subway, it's the same.
Yep.
They've got people scanning for your temperature at the entry. And then when you get onto the subway, you have to register again. So you go up to the QR code that's on the window and register your information down to what train car you are currently in, which is it's on the QR code.
Yep.
The minute you scan it, it already knows what train car you're in out of all the train cars on the subway that day. And then you have to put in your personal information, a measure that is put into place in order to figure out where an infected individual has been. They're tracking everywhere they go there.
Yeah.
And they, of course, everywhere wearing masks. Every single person is wearing masks. The signs always are showing people wearing masks properly and washing their hands properly. They even have an infection detection map, that will tell you where the cases of COVID have popped up. When a person tests positive, you can look on the map and see how far away from you the closest case is. And green on that indicates where there have been diagnosed cases in the past.
Wow.
Again, they block off all entrances so that there's only one place. If you can see a little bit there, that this particular entire block, this whole street, has these walls, artificial barriers, stopping people from just getting on the sidewalk at any given point along the road. You have to only enter in one specific area so that every person coming in and out of this neighborhood can get temperature checked. And they also do this in the workplace. People are working, and you can see they're not, like miles apart from each other. This is like a typical office setting, but everyone is wearing masks. Every office has a virus prevention kit that includes the temperature, non-touch thermometer, single-use gloves, gel for your hands, all of these things. And every day they record workers' temperatures. They record everyone's temperatures in the office, and then they also track where every employee has been. They require employees to tell them how they got to work, where they went to lunch, what they did during the day, when they went home, everything. Every piece of information. At lunchtime, lots of people, to avoid, congregating with others in eateries and restaurants, they bring a lunch so that they can, avoid having to get food from people that might or might not have, contracted the virus. And then when people go home, people are coming back to the country of China. People are coming back to the city of Nanjing. They're forced to quarantine for 2 weeks. They're put in health observation, as it's called. Every single person, doesn't matter if you have symptoms or don't have symptoms. Here, as you just heard, Ruben self-quarantined.
Yeah.
He wasn't forced to.
Yeah, I noticed that. He did it himself.
He did it on his own. But other people in other countries are forced to do it. And in this particular woman's case, who is staying in this high-rise, for observations for 2 weeks because she just returned. She's not allowed to use her air conditioning. So the air conditioning is off in the building, and this is in order to help prevent the virus from being spread by the air. So they have to stay in that building, and in order to avoid people having direct contact with them, even when delivering food or supplies to them, they use an empty elevator. And the employees, one of them wearing a hazmat suit, will come out, get whatever food or other resources this person needs or packages, stick it in the elevator, and send it up to that person's floor. And the person then gets that stuff out of the elevator. So nobody has to have contact with them. Do you think, after looking at all of these things, because this is how they flattened the curve in this city in China, where they haven't had cases now for days, look at all of the safety measures, all of the precautions. Are we anywhere near that in the United States?
Not at all. We're not at all near that. And, I've been thinking about things like this, and people are getting upset that their, civil liberties are being taken away, and losing rights. But it's like, this is an unusual time. The circumstances are something we've never encountered in our lifetimes, and we need to do something. And so, once again, it's not going to be forever. It's going to be for a short time, and that we need to quell the spread of this virus. So if it means that these things go into effect, that extra precautious and not spread this virus, we all have to be willing to do that. And I've even thought when I get groceries delivered, I should have a special place to put them. It's like the empty elevator thing was something I thought that's a really good idea. That, the delivery system is no contact. And, and also sanitizing the bags and packaging that all the food came in before it even comes to my house. So I used the back of my car. And I was thinking that I should just have them deliver it to the back of my car, and I could work out of there, and it would be safe, and, the rabbits and squirrels wouldn't get it, and we'd just be better off.
And, I wanted to do these countries comparisons because I wanted to show you the level of concern, the level of control, the type of tactics. I mean, I know there's people in this country that would scream bloody murder before they let anybody track them on that kind of a level.
Exactly.
But China is a communist country. They pretty much control their citizens' consumption of internet and everything else they do.
Yeah.
I'm not saying that we should behave like a communist country, but those no-touch, temperature
readers,
scanners. Those things look pretty nifty. Why don't we have those?
Yeah.
Why don't people at the airports have those and just scan everybody that goes by? And also, what's the problem with wearing masks?
Yeah.
If everybody was wearing a mask, I think that would help. Although I don't think that we have the supplies to do that. Here's the response. Here's the reason why I think that while in China there's a drone following you telling you to put on your mask or you're going to get in trouble, you can't leave your house because the authorities will weld you into your apartment if you try to leave without a mask. The reality is that here in the United States, we can't give everyone a mask.
Yeah.
Our healthcare professionals don't even have enough masks. So, folks, are we really prepared to stop quarantining when we don't have adequate tests, when our healthcare facilities are being overwhelmed, when we still have people that don't even understand how this, disease is transmitted or cured? I don't think so. I really don't think we are. I think that if we make the mistake of unleashing people out into the world to go back to work again in the name of saving the economy, we're going to kill a lot of people.
Yeah.
And I shudder to think of how things are going to go in India, but I did have a little ray of hope when I heard Dr. Michael Ryan speaking at the World Health Organization about how this would impact India. Listen to what he said.
India, like China, is a hugely populous country, and the future of this pandemic to a greater extent will be determined of what happens in very large, highly populated, densely populated countries. So it's really, really important that India continues to take aggressive action at the public health level and at the level of society to contain, control, suppress this disease and to save lives. India led the world in eradicating 2 silent killers or eliminating them in the country. Smallpox, one of the greatest successes of mankind, a virus that killed more people on this planet than all the wars put together. India, through targeted public health intervention, ended that disease and gave a great gift to the world. India also eliminated polio, another silent killer, and did a tremendous job on surveillance and finding cases and vaccinating and doing all the things that need to be done. So India has tremendous capacities. All countries have tremendous capacities. When communities are mobilized, when civil society is mobilized, when, as the Director General says, heads of state and governments drive an all of society approach. There are no silver bullets here. There are no easy answers. If there were, we wouldn't be having to work so hard. We've got measures we can take now while we wait for other solutions, and we must take them now. So it's exceptionally important.
Wow.
So recently, and I guess this has been going on even since the beginning of the, virus coming into our radars. There's been a lot of talk about how much we need to take harsher steps and where we are. And I wanted you to hear from, this is from the Rachel Maddow show, but they're talking to an expert about whether or not we're ready to take those harsher steps in the United States, and will people heed them?
Mm-hmm.
I don't know, but here's the opinion of this expert on the matter.
In terms of the American capacity to do what needs to be done, some of the things that you outlined in this new reporting feel doable, if not politically difficult. For example, the first thing that you suggested is that the scientists need to be heard, that the people who are doing the day-to-day explaining of what's going on, what the dynamics are of the epidemic right now, what needs to be done to stop it, and why, should be scientists and not politicians. You wrote, in the same way that that General Schwarzkopf was the person explaining what was going on in the Gulf War to the American people. That seems at least theoretically doable. But some of the other things that you talk about, I sort of am reading between the lines, but it seems to me that you're not sure that America will ever get it together to do some of the more extreme forms of isolation and intrusive monitoring.
We are not nearly as together as the Italians right now, who are not famous for perfect cooperation with authority at any time. In Tennessee, people are still insisting on going the right to go to bars and stuff. In England, people, the minute they heard that the bars were going to close down, the bars were flooded for last call. No, and this is just the beginning. This is just an attempt to freeze everything in place. Then the real work begins, and the real work includes, first of all, you've got to get people who are infected out of their homes so that they don't infect their family members. And that means they're going to have to go, even if they have mild cases, even if they have almost no symptoms, they're going to have to go someplace where they can get over it together. And so that the ones who crash, which is a big phenomenon in the second week for people, they seem to be doing fine, and then some of them crash and need to be on oxygen. You don't want to be having to call 911 at that point because there may be no ambulance for you. You'd be much better off in something like the Javits Center, where there's a nurse keeping an eye on everybody in the room who's got a number of oxygen tanks over by the wall so that when you need oxygen, somebody can get it to you, instantly. And plus we need to find the fevers. Plus we need to test literally millions of people, because the first time you get a negative test means nothing. A negative test yields no information. Sometimes it takes 3 or 4 days, even after you have symptoms, for a test to turn up positive. So there's a lot more to do even after we go into a lockdown. And the president is talking about after 15 days, this may likely be over. And that's a disastrous way to look at it.
In terms of finding the fevers, I was interested to see that Dr. Fauci did an interview with Science Magazine in which the interviewer asked him, listen, in China, one of the things they do is they, point an infrared thermometer at your forehead before they allow you into the grocery store, before they allow you on the bus to check to see if you've got a fever. Is that something that we should be doing here? And Dr. Fauci responded positively to that and said, I will bring this up in our task force meetings. Logistically, I don't know if we can do it, but there's a good case to be made for doing that. To hear him talk about a measure like that positively is of interest on its own terms. But of course, it raises the question as to what we would do with people who had fevers. What you've described as these sort of temporary hospitals where people who have mild or moderate illness have to leave their families. People who have fevers and get diagnosed as even just mild cases need to be isolated outside of their home. That would be the next logistical step you'd need in order for it to make sense to widely screen people for fever, right?
Yes. And look, this is tough. You have to see this is an open carry issue. I mean, is it safe to walk into a grocery store while openly carrying a fever? You're endangering the other people in the store. You yourself may not even recognize that you're sick and may need to crash. The fever doesn't mean you're tossed into isolation. The fever means in China you're taken for a test to see what the cause of your fever is. They try to pull out flu, and they try to pull out the possibility of it being bacterial pneumonia and see, okay, if you have coronavirus, now we're going to put you in isolation. We're going to, you're for your own protection. Not everybody's case is mild. It's a misnomer to believe. You've probably seen the TV today. I mean, I had an email from the family of a 25-year-old guy, a very athletic young man. He's in an induced coma and on a ventilator now, and he can't get Gilead's remdesivir drug. And there's a 12-year-old girl in Georgia who is now, may or may not make it. This notion that it's all only going to kill grandma, as if that were okay, has got to stop.
Yeah, I think that the notion that it's just going to kill old people or it's just going to kill and just to say it like that, it's only these people are going to die.
Yeah.
Or to compare it to things that bear no real comparison, like President Trump has done with regard to, and many other people, it's not just him, with regard to the flu or cases of car deaths. The president insisted we can do two things at once. He said, we have a very active flu season, more active than most. It's looking like it's heading to 50,000 or more deaths, not cases, deaths, that's a lot. And you look at automobile accidents, which are far greater than any numbers we're talking about. That doesn't mean that we're going to tell everybody no more driving of cars. So we have to do things to get our country open.
Wow.
But the thing of it is that we know that this is a horrible way to die. It doesn't have to be something that afflicts hundreds of thousands or even millions of people and kills tens of thousands of people in our country. That doesn't need to be allowed to happen. We can do things to flatten the curve. We can do things to minimize the risk. And we have to think about, I believe that part of the arrogance that you're not going to be touched by this virus, that as Americans, we have the best healthcare system in the world and we have the best technology and we're number one. And somehow we're going to dodge this, pandemic. Or for those in power and privilege that have access, to think that, if I catch it, I'm not going to die from it. And even if I get sick, one of those respirators is going to be, reserved for the rich or for the powerful, and I won't die from it. Everything will be done to protect my life. I think that as time goes on and more people realize that is a myth in their head, that is a delusion. Mm-hmm. We already have 5 members of Congress.
Yep.
And just last night, Senator Amy Klobuchar announced that her husband has the coronavirus. And not only that, he is fighting for his life on a respirator right now.
Yep.
That's one person from the representation of our state. But that's not all. Our governor, Governor Walz, is also in quarantine. His bodyguard testing positive for the COVID virus. So he's on a self-quarantine for a period of 14 days. We were just watching last night that a terrifying new piece of information coming from one of the cruise ships. I think it was the Princess, right?
Yeah.
That they went into this boat 17 or 20 some days.
17 days later.
17 days after the last person with the COVID virus left the ship, and it was still alive. The virus was still alive.
It was in cabins and rooms and surfaces.
Surfaces, cabins, rooms. And here's the scary part. The scary part is, what if 14 days isn't enough? And all the people that have been coming home and self-quarantining for 14 days and then going back out into the world didn't stay in long enough and were still carriers. And also, what that expert said on the Rachel Maddow show is that testing one time is not enough. Getting a negative doesn't mean you don't have the virus. So there's a lot of people that get the test that aren't showing symptoms, that could be carriers. They get a false negative, and then they go out and they spread the virus. In the case of Rand Paul, he kept working for 6 days after he took the test. He decided not to self-quarantine after being tested. And this has sparked bipartisan outrage, including from some of his own colleagues. Well, of course it would.
Yeah.
When this thing starts hurting, physically making people sick and killing them at the highest levels of our government and our leadership throughout the country, people will be brought to their knees. That is what is going to happen. This virus is no respecter of person. This virus doesn't care if you're rich, if you're poor, if you're old, if you're young. It doesn't care if you're black or white or Chinese. It doesn't care. It kills equally. It is an equal opportunity killer. So what do we make of the plan that Trump has announced that possibly they're going to let people go back to work? He said, he started off by saying, we can't let the cure be worse than the problem itself, in a press conference 2 days ago.
Wow.
Today, he's announced that by Easter, he is hoping to have the economy reopen.
Oh, boy.
I don't think it's going to happen, dude.
No, I don't either. And again, just the information we got from the cruise ships. You know, and this is so early, and we're not taking care of what we need to do. We are not isolating. The gentleman who talked about when the bars closed, and we're going to close, you know, everybody ran to the bars. Same thing here happened in Fargo.
Oh, yeah.
No St. Patrick's Day parade, but everyone went to the bars that night.
Yep.
Oh, we're going to close the bars at 5 o'clock on Friday. Everybody was at the bars until 5 o'clock on Friday. Yeah. You know, and not wearing masks and not taking precautions, and all these things are going to lead to spreading around and then respreading around and having different timelines. So I think that's way too early, and I think it's also the wrong approach to send to this country, that we're just going to open everything up again, because then people will still think, well, then it's not serious. We're just going to open up all the businesses again, you know, and it's why are we doing this in the first place?
And then, of course, there is the very ugly and ageist argument that only the old will die.
Yeah.
Well, since when did old people become expendable? What about the values that we respect and cherish our elders and their knowledge? I mean, isn't Capitol Hill and the people that are leading our country made up mostly of older people?
Exactly.
So we're advocating that all of those people should just be expendable, that we can do without them. I don't think that that's a good message.
Yeah.
And I think that part of what we're hearing is these lawmakers and, folks that are trying to revive or save the economy that are just, taking the temperature, doing a litmus test. How will it go if I say that old people are expendable?
Yeah.
We get a read on the room. Are people going to be okay with that?
Yeah, no.
And because, bean counters, world leaders, they make life and death decisions about bombing countries and starting wars and all sorts of things. So they may be able to think of, masses of people dying in this risk benefit type of balance ratio. But regular people don't think like that.
Nope.
Everyday Americans don't think like that, and they don't think grandma's expendable. But listen to this governor from Texas try to make the argument that the old people would be on board, like, Hunger Games style, making themselves the tribute for the economy. Take a listen. This is from Tucker Carlson's show.
Is what's happening to this country. And, Tucker, no one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in. And that doesn't make me noble or brave or anything like that. I just think there are lots of grandparents out there in this country, like me, I have 6 grandchildren, that what we all care about and what we love more than anything are those children. And I want to live smart and see through this, but I don't want the whole country to be sacrificed. And that's what I see. I've talked to hundreds of people, Tucker, and just in the last week, and making calls all the time. And everyone says pretty much the same thing, that we can't lose our whole country. We're having an economic collapse. I'm also a small businessman. I understand it. And I talk with business people all the time, Tucker. And my heart is lifted tonight by what I heard the president say, because we can do more than, one thing at a time. We can do 2 things. So, my message is that let's get back to work. Let's get back to living. Let's be smart about it. And those of us who are 70 plus, we'll take care of ourselves, but don't sacrifice the country. Don't do that. Don't ruin this great American dream.
You're basically saying that this disease could take your life, but that's not the scariest thing to you. There's something that would be worse than dying.
Yeah. And look, I'm going to...
No, I'm pretty sure the worst thing that can happen to a person is dying. Yeah. That's it. There is nothing worse that can happen to you.
Nothing else happens to you afterwards.
Yeah. Nothing else happens once you're dead. You're dead. And it is the worst thing that could possibly happen to you. The way that was framed, I don't even know how Tucker could keep a straight face when he said that.
No.
So you're saying that your life is expendable and you're willing to give it. But the truth is that the people there don't really believe this. I really think they're just taking a litmus test, because if they believed that, then they wouldn't have canceled Rupert Murdoch's birthday party over at Fox News.
That's right.
To protect him, because he's an older person that's vulnerable.
Yeah.
They would have said, you know what? Let's have this party to help stimulate the economy.
Let's eat cake.
Right. And they didn't. And let me tell you that this message is being circulated by more than just this governor. Here's Scott McMillan. I don't know who he is, but he sounds like a horrible person by what he said here. He said, the fundamental problem is whether we are going to take the entire economy to save 2.5% of the population, which is, 1, generally expensive to maintain, and 2, not productive. Again, who's running our country? The majority of these people are senior citizens.
Well, they're all productive.
And I would say that they're pretty productive people. My father is in his 70s, and he works from 2:30 in the morning. He gets up at 2:30 in the morning. He works the graveyard shift, has almost for 30 years, and still working. So I think that it's ageist, it's generalizations, and people don't want to kill grandma. They're not going to kill grandma. Yeah. This is a post that someone posted locally. Susan said, the Russians are not using social distancing or lockdown, and their country is tanking too. So before you jump aboard the screw grandma, save the country train, consider that it won't just be grandma. It'll be everyone who needs hospitalization for anything, as those beds will all be full of the people who have COVID. 1/5 of the people with the virus need hospital support. They won't get it, of course, if they get sick at the same time, which will result in higher fatalities than we saw in China, who had more beds than we do. So screw grandma, she's dead, but so is doctor expert surgeon. So is doctor intensive care. So is nurse your friend. So is diabetic your friend. And appendicitis your friend. No room at the ER for his surgery. And car crash your friend. The economy, though, it's screwed anyway because this is a world problem. Suck it up, Buttercup. We are all grounded for as long as it takes. Except nurse your friend, who is working his or her butt off to keep people breathing at great risk to their own self, family, with the equipment of a developing nation. Yeah. And in response to this idea that we should, there was a lot of pushback. Not dying for Wall Street started trending on Twitter. And some grandparents were posting pictures of their grandkids saying they'd like to stick around and see them and saying count me out. Yeah. My death won't enrich my grandkids more than growing up with me here to love them will. And I think that we should not, in this great nation of freedoms, start to preempt and designate who we are ready to kill off, or who we're willing to part with, rather than taking every precaution to save as many lives as possible. And one final thought, just for the sake of levity, I want to share with you this video. You're about to see a priest in Italy. Here he is. He decided to live stream Mass, but unfortunately for him, he activated the filters by mistake. And this was the result.
Buonasera. Ci ritroviamo insieme per pregare, io in chiesa e voi a casa. Oggi è venerdì di Quaresima e vogliamo pregare con la Via Crucis.
They have sunglasses in
e la
there.
benedizione eucaristica.
They just keep switching.
Oh, boy.
Well, I got to say, that definitely would make watching Mass online a lot more entertaining. Folks, food for thought, lots for us to think about, lots of the comparisons that I talked about for us to think about how we can implement here in our country. And I ask every one of you to take care of each other, wash your hands, stay at home, practice social distancing, and, heed the warnings that we are getting from our scientists and our medical teams here in the country. Have a great night, and God bless you all.